Hello and welcome to another episode of the Frontline. I'm Gary Payenda, and today we're going to be talking to Dan Short, a critical care paramedic. We're going to get right into it because it's going to be some pretty exciting stuff. So, the Frontline tries to profile people on the front line of public services. And you can't really get much more on the front line than a critical care paramedic. And I think it'll be a chance for New Zealand to hear a little bit about what they do, what they are, maybe some interesting stories and to just get a feel for the challenges of the job and the rewards of the job too. Full disclosure, I've worked with Dan for years, doing some rescue helicopter stuff. When I was doing that a little bit, doing ED work, he would bring us patients and continues to bring us patients all the time. So without further ado, let's get Dan into this conversation. Hey, Dan Short, how's it going?
Hello.
Thanks for joining us. I think this will be kind of fun because we often do really depressing topics on the front line, talking about the state of essential public services and politics and health policy. But I also want to get in some straight up medical stuff, some really interesting job related things, and talk to people on the front line. So, can you, I guess, to start off, kind of introduce yourself and tell us your background and what you do these days?
Cool. Hey, I'm Dan. I'm currently a critical care paramedic working on the rescue helicopter. Um, I still currently do a little bit of road time as well as a critical care paramedic. I've been involved in the ambulance service coming up 12 years now, starting off as a first responder, making my way up through the qualifications. And then for the last 6 years, been working on the rescue helicopter full time.
6 years. All right. And just for everybody viewing, can you give us an idea of what the difference is between a nurse, a paramedic, a doctor, an EMT, an ambulance officer, a critical care paramedic? Um, where are the lines for all of these things?
Where are the lines? So I'll start off with first responders. So you can volunteer with St. John, do an internal course. So you'll see a lot of them out rurally or within central cities doing like event work. And it's about a 6-month course where you're working alongside ambulance officers, ticking off skill practice. After that, you can get your emergency medical technician or EMT. That's where you can either go do a 6-month in-house program, I think St. John run at the moment, and come out after that as a full-time ambulance officer or EMT. And then after that, we start getting into the bachelor study, graduate studies. So that's your paramedics, nurses, go even further, become a doctor. So paramedics, this is where we start introducing intravenous skill, more in-depth resuscitation skills, a lot more medicines that we can give. And then on top of that, as postgraduate study, you can go and do a diploma in critical care paramedicine. So now we're talking about intubation, adjusting heart rates that are going a little wonky, and a fair few other broad skills, intubation, RSI, yeah.
So to put it in real simple terms, if you graduated or left high school at 18, how many years till you can be a fully authorized critical care paramedic? How
It
many would
would
that be?
it would take 4 years of full-time study to get that side of things, but alongside you still need the work experience. So you'd be having to work your way up, become a paramedic with whichever provider that you want to be with. And then, work as a paramedic for a fair few years. And all these steps have internships. I think currently to get to a critical care paramedic point, it's about a year-long transfer progress to get to, critical care paramedic.
Okay. So maybe 5 or 6 years of work and training and study and all of it?
Probably minimum. It's very rare to see a critical care paramedic who'd be under the age of 25.
Okay. All right. So 6, 7 years till you get that experience. But for paramedicine itself, a 3-year bachelor's degree is nowadays required. There's no more like on the
Yeah.
job training and learning. It's you've got to go to uni
Yeah.
and have the clinical experience in the field.
Yeah, that's correct. Trying to align with the rest of the world. So Australia, UK all do similar sort of programs. But
Yeah.
yeah, at the moment it's all we've got to do a bachelor's degree.
Is every ambulance in the country staffed with a paramedic? When you call an ambulance, does it mean you're getting a paramedic?
That's the idea. Obviously, with staffing issues and the current health system, sometimes that's not the case. So sometimes ambulances will be double crewed with EMTs. If you go even more rurally, when we start looking at volunteer ambulances, it could be an EMT and a first responder, or there's certain communities that will have just a first response unit, which will normally have a paramedic unit backing them up from somewhere else to come transport.
Right. So it is possible, depending on where you live, maybe if you live rurally, that you could have two ambulance officers show up when you call 111, maybe backed up by a paramedic on their way from maybe a bigger center, but it could be two ambulance officers with a minimum of about how much training or experience?
Minimum of probably 6 months, 6 months or
Okay.
more, up to a year to get the EMTs for the transporting units.
Oh, I meant for ambulance officer, just straight up
Ambulance officer,
community
sorry.
volunteer.
Yeah, so it'd be about 6 months before you join to be able to go do
Got it.
response.
And with each level, they can do more, give you more meds, put breathing tubes down, on and on and on, all the way up. And so you now have paramedics who have independent registration, right? Just like a doctor or a nurse would. And you have paramedics working outside the ambulance and in a whole bunch of places. Can you speak to that for a second?
Yeah, so registration for us is probably only about 3 or 4 years old from memory. And when that was introduced, it would be very rare to see a paramedic, a critical care paramedic, or extended care paramedic working outside of the ambulance service. Since that's come in, we're now seeing more and more medical centres, even in hospital emergency departments, starting to employ their own paramedics to do the same skills that we're trained with through university and what we've done before taking on those roles, but doing it just in a different environment to probably what people expect.
So there's a lot of overlap between all of these health roles, and different people and different specialties will be better at certain aspects of all of this. So I guess the goal is someday that all of healthcare looks like this seamless, overlapping kind of quilt where you get the care you need in the right place at the right time, and sort of migrate out to other providers as needed. So, can you talk about what paramedics like don't do? What is a paramedic going to be able to do everything a nurse or a doctor or someone else does? What sort of things are not the first go-to of a paramedic? Realizing that this could change with time and that it's an ever evolving field, right?
Yeah, and I will touch on the ever evolving because the recent introduction of extended care paramedics does kind of blur the lines a little bit.
Yep.
But to say blanket rule, sort of when you start paramedicine, you're more aimed towards the higher acuity stuff, emergencies, that sort of thing, and less towards like cuts, abrasions, things that need suturing, minor infections and stuff. And a lot of what we'll do as a paramedic is get called to these things on the road and eventually refer them through to their GP to go sort out these, to go sort out these issues. We've got a toolbox for emergency care, and then below that, there's not too many tools that we can use. One of the things that they've recently introduced is the extended care paramedic. So again, this is a 1-year postgraduate diploma that you do in extended care paramedicine. And they have the ability to start doing sutures, catheters, fecal disimpaction, and a lot of different antibiotics that they can give to try keep people out of hospitals. And it sort of overlaps a bit with a community nurse role.
And I've talked to GPs who've loved having paramedics around because they are naturally able to kind of quickly assess the problem and quickly intervene. And so, in the urgent care setting of like a GP practice where they're seeing acutes, that might be the perfect setting for a paramedic to get stuck into. Start the IV, administer the antibiotics, deal with an abscess or a laceration, while the GP does what they do. Having said that, obviously all the roles are quite overlapping, but it's kind of cool to see that that's out there, and that you're not
Definitely.
just confined to an ambulance anymore. So you are not confined to an ambulance, are you? You spend some of your time dangling from things.
Yeah,
Is that right?
yeah,
Okay.
that's the
Do you
one.
want to give us an intro to what you do on the helicopter? And we'll just show one publicly available clip from Northland Rescue Helicopter. I just found this on YouTube, and you'll talk us through it. I think you'll recognize the person coming out of the helicopter as yourself.
Yeah, so real quickly, the helicopter work definitely expands what you'll go to, and it does run a little bit differently to elsewhere in the world. So in New Zealand, the rescue helicopters will respond to pre-hospital emergencies like an ambulance. They can also be tasked to inter-hospital transfers, and then the third part of that is we can be tasked for search and rescue jobs. So you end up having to expand your skill set a bit, keep some fitness, get used to going in the water. And so this was one of those jobs. It was about 50 nautical miles to the east off Cape Reinga during some pretty hefty weather and waves.
All right. And you've got a background with lifeguarding, don't you? Can you just speak to that briefly for a second? I think a lot of the rescue swimmers probably would.
Yeah, I think that was something that definitely helped me get into the role that I'm currently in. But yeah, I've been a lifeguard for 16 years, patrolling all around the country pretty much, and got quite used to going into the water and doing rescue operations. So yeah.
Awesome. So set this up for us. What's going on here? Were you guys out sightseeing, looking at dolphins? Were you scouting out good fishing spots? What was happening?
What was happening? We got a call early in the morning for a PLB, so a locator beacon. And we got tasked by the Rescue Coordination Centre, who looks after all the beacon searches. And had a location GPS given for up north off the Cape. So we were responding, unknown how many people were on board. We just know the type of vessel. I think it was about a 40 foot yacht. And the waves we kind of knew inshore, probably about 4 meters, weren't really too confident as to what they'd be like that far out to sea.
Okay, great. Let's get into it. Let's get into it, I say. But easier said than done. Give me a second.
You're all good.
There we go.
Hey there, Heli 5. This is Kaitana Maritime with you. Just from the Rescue Coordination Centre, there is no change.
Let's be honest about this, eh?
Yeah, fully. That's not 6 meters. That's more like 8.
Or 8 to 10, I would suspect.
Yeah. More likely put him.
But you'd swim to it.
You'd swim to it
to do your hooking up with the people.
It'd stay on the wire.
Yeah.
Yeah. But yeah, it's only if this is getting bigger, that boat's already taken on water, that's listing away too much for it to not have.
And guys, it's getting worse, eh? The looking out starting to deteriorate more.
Okay, copy. Alright, clear to bring the medic to drive safety.
Okay.
Medic is coming off comms. Medic's coming off seatbelt.
Who's that guy?
Copy that, and I'm ready.
That's me.
It's located on the...
Let's pause it there. So what do you already know? So the sails are all tattered and torn. The boat's taking on water. It's listing to the side. It'll probably sink at some point. There's a little dinghy or rowboat or something that it looks like someone's in. What is going through your mind right now?
So we'd managed to make contact with the person on the vessel. We still weren't sure how many people there were, but for us winching especially in those seas, directly onto a yacht with a mast is pretty dangerous. So luckily he had a little dinghy on board that we got him to set off to the side and eventually jump into. Just so we
dangerous
had something
because
to aim for as a target.
the winch cable will wrap around the mast and potentially take down the helicopter, take you out, and probably turn it into a catastrophic event. Is that right?
Yeah, definitely. And because it wasn't a person in water, we've got the time to do like a pretty thorough risk assessment. I feel we're pretty safe at work with these sort of things, and we'll stay overhead and talk it through and come up with a plan. So yeah, that was it. Get him in the inflatable, and then get down to him. Probably have to swim onto the inflatable, and then bring him back up.
So I'll already preempt some of the peanut gallery comments and say, at some point they were talking about on there, someone saying, "Oh, it's bigger than that. It's like 8-meter swell." Was that right? It looks like it's about, I don't know, knee high, head high, something in there, because you're hundreds of feet up, looking straight down on it. I'm sure it's a very different situation when you're on a little cable getting dropped off in the water. I would point out that you can see how big the waves are relative to the boat. And when the boat goes into a trough and you can see that the mast is like equal to the waves, then you can guesstimate height from there. But can you talk about that? How big were you surf, right? Right, Dan?
Yeah.
So you have some idea of estimating wave height. How big were these waves on average?
I would definitely say the 8-meter average coming through.
My goodness.
And when you talk about it, especially like what I'm used to, probably in a coastal environment, you think of an 8-meter wave and what that would look like, and it would be this huge dumping thing. But when you're that far offshore, the waves are so like fat when they come through that it is like just a rolling ocean surface. But when you see some of the waves when they actually start toppling over out there, they don't come down with a huge amount of force, but there is just a lot of water that starts spilling over. So yeah, definitely a different experience.
And I guess from the pilot's point of view, trying to cope with the up and down of the waves while they're dangling you around is a whole next level game, isn't it?
Yeah, the pilot and the hoist operator in this case, making sure that when I'm in the water, I don't get plucked back out between waves. But you also don't want too much slack on the cable dangling in the water. So pretty much as the waves are rolling through, both the pilots controlling the height and the winch operators controlling the cable in and out just to keep it safe.
And I'm assuming these helicopters are like Teslas. They push the autopilot button and it just takes care of everything. I'm kidding.
I wish,
don't
not
yell
these
at me,
ones.
pilots that are going to be watching this. Please tell me a little bit about the pilot's point of view of what they're trying to do.
Pilot's point of view, so in this instance, we've got two pilots up the front. The pilot is pretty much trying to keep the yacht in his vision as a point of reference, and that's just going to stop him accidentally moving side to side, back and forth, up and down. And he's literally trying to just keep a point and stay visual and try to keep an eye on things.
And there's a crew person calling out heights and distances and which way the pilot needs to move, right? Trying to help this whole process.
Yeah, so you'll probably hear a little bit of that, but the hoist operator will be what we call conning in the aircraft. So yeah, giving directions, forward and right 1, forward and right 2, that sort of stuff, and that's just helping the pilot make really minor adjustments to how he's flying to try and get overhead.
And then can you just talk about the cable cutter? Because if push comes to shove and you get wrapped up in some rope that's streaming off the back of the sailboat, if the helicopter's winch cable gets stuck in its housing or doubles back on itself or whatever, if it gets really bad, what will happen with that cable cutter?
It's both a saving grace and a really scary thing for me. So yeah, the hoist operator and one of the pilots, they both have a little switch that can cut the cable. But the idea being, if I get in danger or entangled down in the water and it's gonna pretty much drown me, that's something that they can cut and hopefully I can get myself out. The other option being, if there's something that goes wrong with the helicopter, if for some reason an engine fails or anything like that and they need to try fly away and ditch some weight, then yeah, it's going to be a cut off the swimmer so the rest of the crew can keep going, which we all understand that risk and know what it's about. So
yeah, we'll talk about wetsuits later and life jackets.
Definitely.
But yeah, all right, let's keep going here.
And he's moving to the door on safety.
Roger.
Well, coming forward.
Safety's coming off.
Yeah, it's good work. 25
Going to
feet.
stay on the hook.
Roger.
Good swell coming from Steve.
Okay. Taylor, watch out.
Adrian.
Watching out. Forward and right 5. Medicus halfway. Steady right 4-2. Steady forward. Medic's approaching the water. Medicus going in the water. Medicus swimming. Back 2. Right 2.
Roger.
Yeah, it's good. One's good.
Steady right. 4-2.
Wait till the next, after the next dip, hey? No, he's waving at you.
Yeah. Okay.
I can get lower if you like.
That's something. That one ended well, did it?
Yeah, that one ended well. The one patient, and I think we transported locally to meet customs. He had no medical complaints, so it was a successful outcome.
And did he have a life jacket? Just out of curiosity.
2 years ago, from memory, I cannot remember. I'm pretty sure he did.
Because one of the things I remember most from when I was working with you guys was one of the experienced rescue swimmers saying that he had never pulled a dead body out of the water with a life jacket on. Essentially pointing out to me, or trying to emphasize to me, that your chances, if you go in the water without a life jacket, are really pretty horrendous. Cold, exposure, panic, aspiration of water, the waves, the idea that you'd last a really long time, just that becomes a fleeting chance. Whereas with a life jacket on, everything changes, right? You can conserve energy, conserve some heat, and you can stay alive long enough for someone like you to go out there and save them. So if you were if a person were to get knocked off a fishing boat, they're not going to be rescued within seconds, right? It takes a while for a helicopter to come save you. So let's say you're out at sea and you do the typical thing, which is to have a life jacket in the boat, but not necessarily on your body, because you think, well, it's not that bad. But then something happens. How long will you be in the water trying to stay alive before a Dan Short can fly out to you?
Yeah, I mean, depending on the proximity to where the helicopter base is, but I would say expecting an hour at least. If you're offshore in this similar sort of circumstance, expect to be in the water for an hour.
That would be a long time to be fighting for your life with a huge adrenaline surge. So,
Yeah.
what are your thoughts on life jackets? Have you positive thoughts on them, negative thoughts? What are your feelings on that issue?
Through both backgrounds, absolutely. If people are out on the rocks, if people are out on boats, there's no point having it sitting there, because when you need it, you're probably not going to know that you're going to get swept off or anything beforehand. So it's just wear them. Find one that's slim fitting if they're too uncomfy, or even an inflatable one that you can just have on you, and when you get in the water that you can deploy it. They're gonna help save your life for sure.
Yeah. Have you had to do any rescues at sea where the patient wasn't able to stay alive? Have you had to do any kind of body recovery versions of the video we just saw?
Yep. Only one, but yeah, no life jacket, and not a successful outcome. We got there relatively quickly because it was quite close to the heli base, but yeah.
Awful. Alrighty. Moving on from that, what is a typical day in the life of a critical care paramedic? Either we'll do two versions: one who works on a helicopter shift, and then one in a non-helicopter shift, just on in an ambulance. What does that day look like?
We're pretty good at our base. So we'll do 12-hour shifts, and a lot of it is downtime. You're sitting on base waiting for a call out. Per shift, you can expect somewhere between 1 to 3 jobs, what I'd say be a normal day for us. But then thinking about like a job turnaround is probably 3 hours each, from time of tasking, getting there, assessing a patient, transporting them to a hospital, which might not necessarily be a hospital close to base, and then the return leg back to base as well. So yeah, 3 hour job turnarounds average. For where I work, it's about 50% hospital transfers, and then about 45% pre-hospital emergencies that we'll task to with ambulance, and then 5% of search and rescue, police taskings, RCC taskings.
Yeah. And so you are not just going to boats, you're also going to the side of motor vehicle accidents, maybe a remote home where the child has a seizure disorder or some problem, or a cardiac arrest. You're also doing all those kinds of things. You're going, I guess, sometimes to hospitals and clinics where the need outstrips the resources, and so you guys can show up and maybe intubate a patient. So you're in all those different environments. Certainly appreciated by all the farmers and all the rural residents and families that live rurally out here.
I think that's the whole thing behind the helicopters, especially in the medical side of things, is providing that equal access to healthcare. You're talking about all your rural places that might have an ambulance really far away, or a hospital even further away, that they're trying to send you there for some time saving, or also get higher skills, which might take a while to get via road, and get them to scene quicker. And then the other side of that, especially with the hospital transfers, is transferring you from a hospital to a higher level hospital with different capabilities, and actually get you the care that you need. I think one of the biggest ones that you see, especially in Northland, is people having a heart attack. So if what we call a STEMI, if you're confirmed to have a STEMI, you pretty much get a helicopter pre-hospitally, and then get transferred to a emergency capable cath lab down in Auckland, and that's for everybody. Doesn't matter if you're in the centre of Whangarei or all the way up Cape Reinga or anywhere in between. Yeah.
Yeah, it's worth mentioning. So when I was on the Auckland helicopter, we would cover up to the Cape, down to Hamilton at times, rarely even further than that, and Coromandel, really all over the show. You're centered up here in Northland, and you will cover. How far afield will you go?
Generally speaking, it's like Mangawhai all the way up to Cape Reinga. But then there'll be times where, as soon as other helicopters are tasked elsewhere, you'll have overlap of tasking areas. So going down to Waiheke, out to Coromandel, Great Barrier, sometimes down to Waikato area. But yeah. It's
quite an incredible service. It was a privilege to work with with you guys or with HEMS and the helicopter service. It's fascinating. What are the downsides to being a paramedic and working on the front line? Like, what are the risks or the worries or even just the mundane day-to-day problems with being on the front line?
Obviously, there's the exposure side to things. Like, you're going to go see some absolutely horrific scenes, and we all have our own ways of coping with that. Part of the awesome things of being on the helicopter is that we do work in a team of 4 at all times, so you're not doing it alone. So that's really good. And even the jobs that you can handle and stuff, even though you don't feel it sometimes, you know that eventually down the line, probably another 10 years, 20 years, like in my future, that things may catch up. Sort of a gamble you take on the career side of things, and how long you'll last with that sort of exposure. So that's definitely one of the downsides. And then aside from that, personally, like getting into a helicopter role, living in a different place to where the helicopter base is, and kind of going away from home for 4 days at a time, go do 12-hour shifts and then come back for 4 days off. Doing that for 6 years, so
Wow.
it can definitely take a toll on your personal life as well.
Absolutely. Yeah, and the sleep disturbances too. I want to talk about that for a minute.
Yeah, night shifts. You learn to get good at them, but sometimes you're still in the middle of the night. You get a call. You haven't really woken up to your pager properly. You're in a bit of a trance, and it can definitely take its toll on you. There's enough research around shift work and sleep deprivation and what that does later on in life. But it's something you do for the job. Try your best to manage with it.
If you could change one thing about the sort of pre-hospital space, what would be your dream if you could achieve a change that would be system-wide and transformative and really wonderful for patients? What would that look like? What would a fantastic dream of a system look like?
I think it's something that's hopefully being worked on at the moment. But the way that helicopters currently get tasked is kind of in a first in, first served basis. So we do have a tasking or authority that will get all our taskings through. But the way it works is kind of whoever books the helicopter out or contracts it out for whatever job they have is the one that gets it. And sometimes this can mean other patients miss out if there's 2 jobs that come in at the same time. So just being able to triage that properly, get it all through one centered place, and have people with the ability to sort of triage and get the helicopters to where they need to go the most.
Like a coordinated, seamless, unified response.
It's on its way.
It's
partly there.
It almost sounds like the perfect setup for something like AI to do, to calculate all the distances involved, the risks, what you know about the patients, and to try. It's an optimization problem, isn't it? Really, because when these helicopters go away, it means they're not available for another job in general. It's fascinating. So that's what you think is coming, and that's what you would like to see, just a really efficient way of prioritizing cases.
Definitely. Yeah.
Cool. Nice. Is there anything else that you would want to tell the world about the frontline paramedic job? Or any stories that you might have brought along to share?
I'll touch on the road side of things. A lot of what you do on a typical ambulance day, you may get maybe one really unwell patient that you're training, like what you've trained for, that you get to go to in a shift. Most of the time it's going to be a little bit lower acuity. A lot of them end up in hospital, but it wouldn't be surprising if you did a shift where you're assessing people at home and referring them through to GPs, or not even referring them anywhere at all. And sometimes that could be like a whole shift worth. And there's a lot of other sides to the ambulance service that you don't get to see. A lot of end of life care sort of things that will go along to. It can be beautiful sometimes. I have kind of a sad but beautiful story. Back when I was working on the road, we got called to an expected death. So family had woken up, found that their loved one had passed away in the night. He was end of life cares under hospice, and called the ambulance. And it comes in at a bit of a lower priority because they're already expected to pass. So we cruised along there and came in and go through the verification of death process, and woke up his partner. And sat there for about probably an hour and a half with everybody, had some cups of tea, did the paperwork, had some nice stories shared, and then left them to it. I think the daughter was there as well. I was a little worried about how mum would take it, but she was doing good, and everyone was feeling at peace that he'd passed away. And then so we left. And then about an hour later, got called back to the same address for a active cardiac arrest for a non-expected death. And the initial patient's wife had come into his room after we left when she was ready, gone and placed her hand and held his hand, had a couple breaths, and then cardiac arrested herself. And it wasn't a successful resuscitation, but everybody who was there, the family, were kind of grateful that it happened because they didn't know how she would cope without him there. And kind of a beautiful story of broken heart syndrome, but also they went out together. They'd had a full life together, and there was a little bit of nicety in there.
Oh, it really highlights the sorts of things you see that no amount of lectures are going to prepare you for. There's no way you can have a textbook or a classroom session and actually be ready for that happening. I mean, someone can tell you about it, but living through it must be quite a surreal experience. And I think it highlights also for me the fact that as an emergency doctor, ambulance staff will bring us patients, and we only see the ones that make it, or at least mostly make it. We're not seeing a lot of the trauma that you see, a lot of the deaths that you leave at home. And also, there's a significant number of patients that you don't end up bringing in to ED for various reasons, perhaps because they're end of life, or perhaps because they're well enough that they could be kept at home. So I think there's just like what each of us sees about an ambulance officer's work or a paramedic's work is like a tiny fraction of the richness of what actually happens out there. More than most, you get to see what life and death is like in the real world, which is, I'm sure, a privilege for you, and also a big responsibility. Do they look after paramedics' well-being and mental health and coping mechanisms? Because like anybody, paramedics are going to have depression and mental illnesses of all kinds, schizophrenia, bipolar disorder that's managed. I mean, you name it, but I guess commonly just depression. It's a common thing in society, right? It seems like this would be particularly hard in like a sleep-deprived setting to be managing these sorts of things. So what sort of coping do you do, or do the ambulance services provide to help people negotiate that aspect of it?
Sweet. So all the organizations that I work for, they have peer support programs in place. So select clinicians that have external training just in supporting peers, and that's kind of the first reach out point for us if we do need to have a yarn. I think a lot of us are pretty good at coming back and debriefing pretty gnarly jobs with each other anyway. So there's that side of things, and then both organizations as well offer external counseling. So we have 24/7 availability to call up a number and ask for a counselor. and get some free sessions through that we can keep going if we need it, if they think that we need it. Definitely something I've engaged with in the past and still know it's there if I need it. So there is actually good support for us.
That's pretty awesome to hear. If you could talk about for a second, folks with lasers, folks with beacons that go off randomly, or folks that might think it funny to call for an ambulance. What, like, do you have a lesson or a teaching you can give to those people?
The hoax calls. Yeah, it happens. It happens now and then. It is frustrating, and it can take away helicopters, ambulances from other patients who really need them. And there's been a couple times that's happened in my career, and it's so frustrating. A lot of the time we can pass that sort of stuff on to police, and they can come and check it out. I don't really know what they do past that point, but I definitely know they'll go attend and have a word. And the lasers is an ongoing issue. We'll get laser strikes maybe every couple months of someone who thinks it's funny to point a laser up at us. And most of the time,
I think it's worth mentioning, like, that can cause short or long-term blindness in the pilots. Sometimes they'll be using goggles and things, and you can imagine if they lose visual reference, if they're at a critical mode in the flight where they're close to land and they're having to rely on their depth perception and their vision, that sooner or later will cause the deaths of everyone on board. Yeah, I think from the point of view of just some guy playing around with a laser, it might seem funny, but from the point of view of a crew with a transiently blinded pilot, it's very not funny. Have you
completely agree.
Have you been in the cabin when that's been an issue in the past?
Yeah, it's amazing how much, like, especially over that distance, how much a laser can light up the whole cabin. If the pilots are on MVGs, if that goes
Night vision
directly
goggles?
night vision goggles. If that goes directly into the night vision goggles, it can actually blow the bulbs on them and stop them from working. So it can damage equipment. And I think we're lucky where I work that we have 2 pilots. So if one does get discombobulated from that sort of thing, the other one can take over. But operations around the country that run single pilot, that can absolutely cause a fatal error mid-flight if it's at a crucial phase.
Yeah. All right. Tell us a happy thing to end on. We'll end this with your final story. Have you got what's a nice save that you remember, either on the road or helicopter? You probably have good cases every few weeks. So what's the last good case you recall?
Oh, what have I got? You're gonna have to give me a second on this one.
No, please take your time. Take your time. I'll just do some filler talking while you think, and I'll just say that in almost every case, there's this good feeling that you can allay anxiety and fear, even if you didn't necessarily do something medically with the patient, even if you don't necessarily transport them. For a lot of people, they will remember the sound of the helicopter's blades for the rest of their lives, and they will be immensely, deeply thankful forever. And so that's a really humbling thing. In some ways, a little bit almost, in a way, unfair, because there's so many people in healthcare that have, and not just healthcare, the crew and really the mechanics. There's so many people in the greater realm of essential public services that really do deserve amazing thanks for what they do. But I think it's just glaringly obvious when the helicopter comes. It's all concentrated into that one point, and you get to see the relief in on people's faces when you do walk up to them. But have you thought of a nice story for us, or
Yeah, no, I think so.
please?
It would have been halfway through this year. I think we'd gone to a patient who had collapsed, had some back pain, abdominal pain, and we'd responded. He'd regained consciousness. All his vital signs were actually pretty good. Just a little bit of a low blood pressure. But there was something just a little off about his presentation. We've recently had introduction of ultrasound into our service. So tried the best that I could to scan and just have a look inside his tummy in case there was any bleeding or anything that we'd missed, and found a rather large aortic aneurysm that was not known to the patient. So from that, and with his presentation, we'd kind of conclude it's either ruptured or starting to tear, and we were able to transport him directly to a facility, kind of bypassing the closest hospital for him to go get a repair done. So yeah, it was real nice.
A ruptured AAA. Those are the kinds of things that go straight to theater if you're lucky enough to be at a hospital with a vascular surgeon, which in Northland, we don't have vascular surgery, so it's absolutely essential that they end up quite quickly at the right place, because there's a death rate associated with each passing hour of a ruptured abdominal aortic aneurysm. And the worst bit is that probably 1% of people over 60 are walking around with a small AAA, and they expand over time, and one day they can rupture, and you might think it's just a kidney stone or some back pain, until a paramedic comes along with an ultrasound and is able to get you diagnosed and to the right place quickly. So that's a pretty awesome save. Yeah, wonderful. Thanks for your time with us. I appreciate not just the work you do, but also being willing to talk about some aspects of it. And hopefully this will reach a few people out there and give them a new understanding of what it is to be a paramedic. Maybe even inspire some 17, 18-year-olds to look into being a paramedic. Are you happy you chose paramedicine, Dan? You pretty much have to say yes, right? Oh, good. All right. Good. I'm glad. No, but are you satisfied?
Yeah, definitely satisfied. I'd kind of come out of high school thinking I was good at chemistry and started doing a Bachelor of Science, lasted a semester, was not enjoying it. And then with the surf life-saving background that I've got, getting the helicopters coming and helping us out on the beach and doing the rescues, but also the medical stuff, that was like, that's something that would be cool. I wish I could do that. So yeah, I just decided to switch over to paramedicine, and haven't regretted it since. Got to where I wanted to be.
That's awesome, man. You're living the dream, Dan. Living the dream. Although I'm sure, as you alluded to, aspects of it are very hard, and it's not for everyone. But it does sound like it is for you. Thanks for what you do, and yeah, we'll have you back sometime, maybe to talk about that lifeguarding stuff. Thank you, Dan Short, critical care paramedic, and hopefully some of your friends will watch this and give you a ribbing for it. I'm sure.
Yeah,
part and parcel of it. Thanks for coming on the show. Appreciate your time.
No worries. Thank you.
Anytime. All right, that's the end of another episode of the Frontline. If you find this content interesting and you want us to do more of it, just let me know. Get me some feedback through the Frontline site, YouTube, Spotify, Apple, and of course BHN network that produces this for us. So we had Dan Short on today, critical care paramedic, and next week, who knows? We'll try to keep it interesting for you. See you next time.